Disclaimer. This program is intended for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The following program is intended for mature audience only.
Hi, I'm Dr. Kathy Swain Jones.
Hi, I'm Dr. Denise Joseph Zollicoffer.
Hi, and I'm Sonia Williams Finney.
And this is
Menopause Diaries, real talk, real stories.
Hello, and welcome to Menopause Diaries, Real Talk, Real Stories. I'm Dr. Denise Joseph Zollicoffer, nurse practitioner, and I am really glad that you are here. If this is your first time, welcome. You're in for a wonderful ride with us. If this is not your first time you've been here before, thank you for coming back, and please spread the word about Menopause Diaries, because this is where we just dive deep into us, what we go through as women and how it impacts us, and hopefully spread the word to other women so that they can talk about or feel free to talk about their menopause stories and get some help as we go along. So I am so glad that you are here today. So not only do we want to share real stories and have real talk, we also want to make sure that we're providing some real solutions. And with that in mind, we talk to a lot of professionals, and we want to make sure that we're meeting the needs of not just us as your host for the program, but other women out there. So with that in mind, we have brought on board with us today Dr.Jean Johnson, and she is from Rejuvenation for Her. She's a board certified physician, and I'm going to not steal any of her thunder and really have her tell us about her practice, how it relates to menopause and menopausal symptoms. Dr. Jean, welcome to the Menopause Diaries podcast.
Thank you so much. Thank you so much for the invitation.
We are glad you're here.
Looking forward to sharing some information. I'll start by saying that I'm a breast cancer survivor, and my menopause problems started a bit earlier than what they were supposed to because of the breast cancer. I'm not sure if most people know that breast cancer treatments, that's including the mastectomy, chemotherapy, radiation, they actually cause you to start menopause earlier. So if you're in your 40s and you have breast cancer, your treatments can put you into menopause before your normal body status of getting into menopause. I was 52 years old when I was diagnosed, and I had a bilateral mastectomy because I had a very strong family history. I had what they call ductal carcinoma in situ, so it was non-invasive, but because of my family history, I decided to go ahead and get the bilateral mastectomy. And that really put me into menopause early. I know they say that it's not supposed to, but everything is connected. You remove the breast tissue, it's all connected to your brain, the rest of your body, your uterus, how your body functions when it comes to intimacy, all that is affected.
So, can I ask a quick question, Dr. Jean, before you go on? So if I'm a woman, let's say I'm 37 and I got diagnosed with breast cancer at 37 and opt for a mastectomy or anything like that, does that mean that pretty soon thereafter I may start having menopausal symptoms?
Well, you may, if you just have a mastectomy, you may not have menopausal symptoms. But if you have chemotherapy, the chemotherapy and the radiation therapy, because that's what, like, somebody maybe in the age of 37, unless there's a strong family history or that diagnosis of something called, they have a BRCA diagnosis, or what they call the resistant, the very strong or very, what would I say, aggressive, triple negative breast cancer. That breast cancer has very little response to anything, so they go very aggressive on chemo and radiation for that type of cancer. When you get chemo and radiation and you're 37, you're going to get some menopausal symptoms because the medication destroys the ovaries.
Gotcha.
So your ovaries are producing estrogen and, making all the body parts work the way they're supposed to. That's totally, you go into menopause. Now, after your treatments are over, maybe years later, you may start getting a period again, but most women will go through menopause. The radiation itself causes very severe vaginal dryness.
Mm.
And I just wanted to add something from the functional medicine standpoint also. Let's just say for that 37, 38-year-old woman, when you talk about the amount of stress and what stress and the inflammatory, the autoimmune response to our body and the disruption in the microbiome added to whether she's had chemo or not chemo, and moving forward, you also see a lot of breakdown or just imbalance or at that time, because she then becomes just from stress alone can become an unhealthier track moving forward because of the disruption to the microbiome. So along with what the things that Dr. Jean does is that when we address the inside and the outside, a lot of times we are then setting her up maybe to delay a 37-year-old, possibly to delay those. Again, like Dr. Jean said, it's a lot. It's also very difficult with once they've had the chemotherapy.
Yes, it's very difficult.
Yeah.
So, and these are things, it affects your intimacy and then just your overall thoughts of your body, how you feel. So then it becomes a mental issue.
Mm-hmm.
So it's not just a physical, it becomes mental, because then you have that when you remove, like a breast is like removing any other body part, a leg or an arm or something.
Mm-hmm. Mm-hmm.
So you become, very conscious of that, and then your body, that dysmorphic changes that go the way it looks. It can cause very, mental. So then you also, that affects your intimacy also, because then you feel ashamed. And so that's kind of where I started. When I had my bilateral mastectomy, I didn't have to have chemo or radiation, but I went into menopause like literally after my surgery. I had one period and that was it.
Wow.
I was 52, but usually you'll go into menopause like consistent when your mother goes into menopause. So 55, 56, I believe that I would have gone into menopause at that time.
Mm-hmm.
But I went to menopause at 52. And then it takes about a couple of years because your ovaries are still producing estrogen. It's just in lower amounts. So each year that number gets less and less and less. So it sort of gets worse. The symptoms get worse. You feel less, that you don't really want to be intimate. It can be very painful. Intimacy can be very painful. And so that's when I thought solutions. I was like, okay, this is our century, and it's too much out there to not have a solution. So then I did my research, and that's how I sort of got started. And then once I found something that I felt was helpful, which was the laser, I started my own company, because after I received so much relief, and then continued to be able to live a life with intimacy involved after menopause. I felt like it was necessary that I share it with other women. And that has been a little bit difficult because it is a taboo subject.
Mm-hmm.
And most women, something is wrong with them, but they don't understand that so many of us are going through the same thing. So once I did that and I purchased a laser, I just started my own company and said, well, I'll just, one patient at a time, one woman at a time, I'll share this information and it'll build. It's going to take me a while because I didn't have my own clientele. I had to build my clientele. So I didn't really care about that. All I was concerned is that people knew the information, and I made the investment, and this is where I am right now. And I called the company Rejuvenation for Her because the treatment in itself helped me, and everybody that I told about it would make comments about how who's happy, my husband is happy, and that. And I was like, no, this was me. And company Rejuvenation for Her, because everything you do is for you. Whatever comes along with it.
So you started this out of your own need, your own story that you saw to do this. And this is part of why we do these menopause diaries, because we want to make sure, just like you said, we would need to get the word out, to people, and start with one person, and one person tells another person. And then next thing you know, we're a community that's talking about living with these and strengthening each other as we go along.
Yes, yes, absolutely. So that's sort of my story. And I started 10 years ago. It's been a slow, gradual increase in, getting the information out and talking and meeting different people. And that's pretty much my niche is the vaginal rejuvenation with the laser. It's a non-invasive procedure. It stimulates the vaginal walls. As we go through menopause, those walls change because we don't have the estrogen exposure. So the wall kind of thins out so that it cannot accept like the penis without discomfort, because the area gets drier and the walls are thinner. And the laser actually plumps the walls up and restores the vaginal tissues. And then that allows you to have intimacy again without pain, to actually enjoy the intimacy again. And it has helped so many women. And I just see it when I have clients coming to the office, really, really just deflated. And the self-esteem and the mental health is really affected, because you don't get sometimes you'll get a partner who is very concerned and saying, maybe we should seek help. And you have other partners who saying, well, what's wrong with you?
Right.
So I get patients like that too. So it's about 50-50. Some I get husbands that call me, or partners that call me for their wives or their partners. But a lot of it is very harsh. And so the self-esteem and everything is really damaged by it. But by the end of their treatment, they also understand that it's for them, and they feel better because the area feels better. And whether they stay with their partner or not, they're very thankful and have gratitude for actually having the procedure done.
Why do you think it is that some of the patients come in with, misconceptions and myths, or do you think it's just that they just don't know that these treatments were available?
So,
is that what you find?
Well, what has happened is when this treatment, they've been doing this treatment in other places, like in Europe, they've been doing it forever. In Canada, for urinary incontinence, because the laser helps, instead of promoting surgery, they do the laser. Now they do laser, and it's paid for, so that they don't have to go to surgery and have APR repairs and all these major surgeries. At the same time, you're getting a treatment for urinary incontinence. You're getting vaginal rejuvenation. So it helps overall. But what had happened in the beginning is they announced this as a cosmetic procedure. And cosmetic, somebody's like, well, people don't want to have cosmetic procedures. But this procedure is really all about function. But because they put it out there as if it's cosmetic, then people saw it as just having some kind of cosmetic. And it sounds so invasive when they say vaginal rejuvenation. There's a surgical vaginal rejuvenation, but there's a non-invasive one, which is the laser. And the surgical one is usually just to tighten the vaginal area for women who have totally lost tone and just have no feeling in the area. You can have a procedure to tighten it, but it's a surgery. This is a laser, non-invasive, and it's really function. It is not, as far as I'm concerned, it's not cosmetic. Now, there are some cosmetic things that we can treat with a laser. So I do that also. But most of it is function. You're repairing an organ that's been affected by going through menopause. And most women will find that important, but most men, I don't think they find that important, because they don't really know what happens to us when we go through that change. Now, as they find out more, then they, it's like, well, this might help my partner or my wife or whatever. And so then they're like more open to it. But it's not a cosmetic procedure as far as I'm concerned. It's more about function.
Yeah, I agree with you. I was in Dubai and Abu Dhabi around 2014 till 2020. And I was able to get certified by the European Society of Aesthetic Gynecology, which so we had an the ALMA CO2 laser, which
Yeah.
was, like you said, we did treatments every day. It was normal. It was expected. All our breast cancer patients, leaking patients, that was the thing we went through. When I came back to the US and went into corporate medicine, and I thought, it was demonized. It doesn't work. It does work. And
Yeah.
they didn't want to hear it. They put every barrier to even utilizing such a wonderful technology. So I
Yeah.
understand exactly what you mean, but I didn't understand. And one of the things is, I was so happy to be able to be certified over there, because at that time I wouldn't have been able to be certified here. It was I mean, we just totally didn't include the US, because
Yeah.
they just didn't, they just didn't want to see the benefits in it.
Yes. And then
And for the urinary leakage, the amount of women that can benefit from that, though, 3 treatments of that and move on, it just didn't make sense.
So,
exactly.
Dr. Jean, for our listeners, I just want to clarify. So, the laser treatment that you're talking about, so it does a couple things. Are you referring to the same treatment that it repairs vaginal dryness, and it repairs and can help with incontinence? I just want to make
Yeah.
sure that our listeners understand the process. And
Yes.
can you tell us what what is the name of it, and just give us a little bit more about that?
So yes, it's a laser vaginal rejuvenation. It's non-invasive. It involves no cutting.
Mm-hmm.
And it's a no downtime as far as being able to go to work the next day, nothing like that. And it helps vaginal dryness, it helps urinary incontinence, it helps painful intercourse because it stimulates the production of collagen and elastin.
Okay.
Elastin, which allows the vaginal area to stretch.
Mm-hmm.
So once we lose that collagen and elastin, that's just a part of aging. Once we lose that, it doesn't stretch. So that's where pain comes in. And then it doesn't stretch, and then it's dry because of aging, because of your loss of estrogen.
And how many treatments would a person need to get?
So the recommendation is 3 to 4 treatments, 4 to 6 weeks apart.
Okay.
And the only
Painful,
downtime
these
that
treatments? Are they painful?
not with me. So
Okay.
I actually use a local topical. I just use local topical anesthetic. It numbs the area. There is an internal and an external portion. Now, the external portion of our body also ages, and people don't like the way it looks. So the laser also, it just restores the skin. Now, the vagina is actually skin. It's internal, it's endothelial. External is skin. So just like we have laser for our face, we can have laser in that outer area to improve the look. But it also restores the internal because it's just skin. So you're putting laser, just like you do for your skin, into the vaginal area, and it restores, your body heals, and that's what gives you the result. It's not the treatment, it's the healing. The healing brings all of the different tissues, and when you have a cut or things like that, all of your immune system, everything comes to that, and then it nourishes the area. And that's where you get the relief from the dryness. And also it stretches better over time when you're restoring the elastin and the collagen, and you just function better. That's basically what it is. It's 4 to 6 weeks apart of the treatments. The only downtime is that in between treatments, you can't have intercourse for 7 days. So it's 7 days of nothing that can go inside the vagina. So no sit down baths, no getting into like a jacuzzi, nothing where bacteria can enter the vagina. And pretty much anybody can do this procedure My oldest patient is in her 70s. I have like quite a few patients in their 70s because Viagra is like a big deal in this population now. And Viagra and 70-year-old vagina does not go together. They don't mix. So
I'm happy to hear that there's hope for me then.
yeah,
Absolutely.
So I get 70-year-olds and no problem.
Especially in Florida, even 80s. And it amazes you, and they're proud of it. You
Yeah.
know, they are very proud of it.
Yeah, I think my oldest patient is 78.
Okay. So there's hope. There's hope. I don't have a partner now, but there's hope.
Yes, there's hope. There's hope.
So Dr. Jean, if someone has severe atrophy, how do you approach that, and how do you get to the, you can barely get a finger in, much less anything else. How do you approach that?
Okay, severe atrophy, I approach a little bit different. So with severe atrophy, you will most likely need something to get the vagina ready for the laser. So the laser has to have moisture. So what I usually do is either we pre-treat with an estrogen insert, because that's not absorbed into the body as much as giving yourself. Now, some people do the bioidentical hormones, but because I was a breast cancer patient, I didn't promote that. And most of my patients who come to me, they want to have something more natural. They don't want to do anything with hormones. But we have to sometimes, just for a short period of time, use the intravaginal insert, and then we use the laser. Once we use the laser once, then you almost may not even need the intravaginal insert. Or if it's really severe, we still use it around the 3 treatments, then you're off of it. But it's up to you. And the way that intravaginal inserts work, sometimes you have to insert every day, and it goes to maybe once a week. So you would have to use it less. So the goal is really to use less of the estrogen. And the more you become active, then the area becomes more receptive. So the key thing is that once you have the laser, you have to keep being intimate. Then you will have to use less of the hormone. And that's basically it. So that's always our goal, to get to a point. But that I kind of prepare for someone who has severe atrophy. Now, sometimes I have to treat one side. We do whatever we can. And then the next time we treat the other side. Whatever is tolerated. Once we treat one side, the next treatment is easier. We treat the other side. Then we take our time and we go 6 weeks later, we treat the whole thing. And then it's a process. It takes time. But just about anybody can come back to functioning with this laser. It's just everybody has to be treated differently.
And so are the inserts that you put in, do you have different sizing as you go along?
The inserts that I'm talking about are estrogen inserts. So those kind of
suppositories, right? It's like a suppository?
Yeah, like a suppository. So those are smaller. But what I do, once we get through one treatment, you can use as far as making the area larger, and also helping your mind to know that something can actually go there. We just use toys.
Okay.
So you start with a smaller one, then you go to the next size, like vaginal dilators. But the key is being able to get in there first. To get in there first, you have to have something that has moisture, that creates the moisture. Usually is your estrogen suppositories. We treat with a laser. Once we treat with a laser, then we use the dilators, vaginal dilators, which are toys. Then your mind is ready to receive. Then your body becomes ready to receive. So it's a lot of coaching that goes along with it. But let me tell you, it works. It just takes sometimes more time for others than somebody who's already been very active and they catch it ahead of time. It's no problem. But somebody who hasn't been active and they have atrophy, we just have to do it slowly, and we just do it one step at a time. But it is not impossible. It's a process. I have people who haven't had sex in like 3 or 4 years, and they got back together again. They weren't getting together that way. They were doing other ways for fulfillment, but other things for fulfillment. But they were saying, we haven't come together in so long, and I've gotten them back together.
That's so good to hear.
Yes. Yeah.
So if this person come in now, you said you would give them vaginal estrogen for at least 7 days before the first treatment with the laser?
I would say 2 weeks. 2 weeks before.
Okay. Mm-hmm.
Yeah. And so those are just the vaginal inserts.
Mm-hmm.
They're estrogen. And some people may need more. Like, it depends. It's it goes by micrograms. So 4, 10. Some GYNs use something else. They use it's estradiol, basically. So it depends on where you are. You may need more, but at any rate, we need moisture. So the way we get moisture is through estrogen, really. And then we put it inside, and you do that X amount, and then you come for the laser treatment. Once we do the laser treatment, we can decrease estrogen over time. But most of the time, I'll keep them on the estrogen throughout the treatment because it just gives us more, especially pain. Once you start having pain during intercourse, you got to use the estrogen inserts. So I'll keep it on a little bit longer than someone who's not having pain. But I found that with the laser and the estrogen together throughout the treatments cycle, which is my 3 treatments, 4 to 6 weeks apart. So you're talking 3 or 4 months of being on the intravaginal insert. And then you can go from having it every day to like once a week if you need to, and to like nothing. Once you become more active in that area, you won't need the inserts.
So once you have done this, is this something that people have to continue doing repeatedly, or once you're sexually active, now that the sexual activity is going to do what the laser has done?
So you have to, depending on where you are in the menopausal, I would say in your hormonal levels of estrogen. So I do my touch up. I do one touch up. The first treatments are a treatment of 3 to 4. Then you can do a touch up once a year to re-stimulate the inflammatory process. Most people, like my 30-year-olds, they come for tightening. So they don't really need the hormones, but they just come for tightening. So when they feel like the area is more loose from, using a lot, then they'll come and they'll get a touch up. Usually it takes just one treatment to help you touch up. For our menopausal patients, I just didn't want to feel like I had felt ever. So I always at like that one, you can kind of tell when your estrogen levels have fallen or if the treatment you need a touch up, and you're like, okay, it's time for me to go to touch up. 1 year, 1 year and a half, one treatment, re-stimulate the inflammatory process, and you're good again.
So the treatment, so it helps with dryness, it helps with incontinence, but it also tightens as well?
Yes.
Okay, so I didn't realize that. Okay.
Yeah, it tightens also.
Okay.
And when I say tighten, it doesn't make it, the collagen and elastin is what makes it tighten. But remember, you still have elastin. So it's kind of like a misnomer in that it sounds like if you tighten, how's it going to stretch? When you have elastin, it gives that ability to stretch.
Okay.
But then it kind of bounces back.
Like kind of like a rubber band, like
Yeah,
they
that's
like
stretched out.
Yeah, it stretches when it needs to stretch comfortably, easily, and then it reverts back to. Okay, that makes sense. Okay, got it.
Yeah.
So, I know also from I happen to have visited in your office, and I know that you also have some other things that you use to help with women with menopause and incontinence as well. I believe in your office. There's another machine or something there. Is it what is that called?
That one is called Emcella. So it's something that you don't have to have any, if you have your mild to moderate incontinence, you just sit on it and it stimulates Kegels for you, like 20,000 Kegels.
Mm-hmm.
And you don't have to remove your clothing, anything. You just sit there and it promotes the Kegel for you, because a lot of incontinence is pelvic floor. So pelvic floor strengthening, it's hard to do the amount of Kegels that you need on a regular basis to keep the pelvic floor strong. You can do it, but this one increases the amount that you can do in a shorter period of time.
Mm-hmm.
So that one is called Emcella, and you basically sit on that. It stimulates the muscle in that perineal area, and that helps the pelvic floor. So what I do is I get about 70% success with urinary incontinence, maybe 70 to 80 with the laser. I combine the treatments to get 100.
How many treatments for the Emcella, and what's the recurring treatment for that?
So it's 6 treatments. It's 6 treatments, 2 a week. You can come one or do 2 treatments a week. for 6 treatments. And then you can tell also when you need to maybe have another one or another run of, say, 3 treatments. But it's like a workout. So just like you got to keep working the muscle. Now, if you're doing the treatments and then you're still doing your Kegels after you finish, maybe it'll be less time for you to come and do another treatment. But for the most part, maybe it just depends on you. And I help, I have a package for that so that when you have to come in and do more treatments, but they're just so easy. You just sit down and
Because there's always that patient who doesn't want to have surgery. She'll go to the pelvic floor PT and say it worked, but the only thing about it is I have to keep doing it. So I was wondering, would the chair be a good option for that patient who knows she can do them, knows they work, but maybe want to do more of her maintenance coming and doing the chair therapy?
Yeah.
How often, if somebody is once they're continent, how often would they have to come for just like a touch? It would just really depend on the patient. So like if she could go 6 months and maybe do a 1 or 2 treatments every 6 months, and if that worked for her, then trying to do daily, because a lot of patients, will revert to the surgery or revert to something different because they know the Kegels work. They just don't want to do it, or they just don't keep up with it. I mean,
Yeah. And I would say 3 treatments for maintenance, and then they may want to do the 6, but 3 treatments for maintenance. And then you may do maintenance every 6, 8 months.
Yeah. It was the same as we do all the other things. You just add that in.
Yeah. You don't take off your clothes for this. No, you just sit there for 30 minutes.
Uh-huh.
Kegel. It does the Kegel for you. 20,000 Kegels.
Yeah.
Yeah.
Well, I know for
Well,
me,
and here's
like,
here's the
I never knew.
thing. Oh, I was just going to say, the thing is, we just need to, again, as we begin to learn about these things and then accept that these are part of healthy aging, healthy maintenance. We deserve whatever time it takes to go and do the treatments that keep us feeling good and healthy.
Absolutely. I was going to say too, for me, like, I mean, I always wonder, and it's hard to know or what, I mean, people try to tell you if I'm even doing the Kegel right. For me, that's the biggest thing for me is, I mean, I believe I'm doing it right when, when I'm sitting there, sometimes I'll be like, oh, let me try to, especially for someone that had severe issues with incontinence like me, where you were waking up, 5, 6, 7 times a night, and you're waking up exhausted because you haven't gotten rest because you can't sleep because you're constantly getting up to go to the bathroom. So for me, I would, often try to say, okay, let me try to do these Kegels, or even, when sometimes if I've got to go really bad and I'm like, oh Lord, I'm not going to make it. Let me try to, try to do some Kegels to give me some time to get to the bathroom. But so that I know for me, that was always a concern as to whether or not, because they say, if you don't do them properly, I'm like, well, I think I'm doing it right, but it's inside and I can't show you, you can't see. So how do I know if I'm doing it properly?
Well, and the thing with Kegels is it takes a minute to get to where you're doing them right and you're doing them strong and you're doing them enough. And by the time it's like going to the gym. If you go to the gym for 2 weeks, 3 weeks and give up, then you were right before you felt like, okay, this is working. It's the same with Kegels. By the time you get there, you're so worn out on doing them, or you feel better and then you stop doing them because it's a chore.
Yeah. How many, I mean, I'm just asking. So what, like, I mean, if someone were to just go strictly the Kegel route, like, how many are you supposed to do a day to like, or how, like, what's the frequency or how many? I mean, Dr.
What do you say, Dr. Jean?
How many are you supposed to do a day? Can you?
I mean, like, to how many Kegels should you be doing if you are at home and you've got incontinence and they're not coming to see you, and someone wants to say, I want to try this at home to see if I can, help build my muscles down there. What's the normal amount? Like, I don't even know, because honestly, after like, I don't even know if I can do 10, without like, it's a chore to me. It's like, like, okay.
And when you first start, you have to use your whole body to get.
Yeah, well, that's what I'm saying, I'm trying to do it now, but I'm like, but yeah, so I know.
I don't know how many you would have to do. I just know that this chair does like 12,000 in like 30 minutes. So
Well, let me tell you what I would tell people just to get them to do them, and they would do it, and it works. But okay, so here it would be: I would tell them to do 6 Kegel, hold them for 6 seconds. So you would do one, and then you do 1, 2, 3, 4, 5, 6, and then at the end of the 6, you do 6 really fast ones, 3 times a day. So what I would say is do them on your way to work, do them when you sit down for your lunch, and do them when you're driving home from work. Now, somebody who's leaking is going to do that. And then when they find, okay, I'm continent, they'll stop doing it. But it's just like going to the gym. When you stop going to the gym, you think, oh, well, yeah, I did lose the 10 pounds going, but I don't know if I want to get up at 6:30 every morning and go again. It's
right.
that same thing. They work. So basically, if you wanted somebody who's in a tight spot, just tell them do 6, hold it for 6, do 6, hold them for 6 seconds, and then do 6 really fast ones 3 times a day until
That's good information.
you're continent. And most people, and especially if they're on like a little hormone therapy vaginally, most people within 2 weeks or so will stop leaking, but they got to keep doing them.
Yes, yes.
Well,
And
you saved my life with the estradiol. I'm the poster child. For incontinence. I was incontinent for 10, 12 years, running back and forth to the bathroom. And I'm happy to say that I can get through meetings. I can sleep. I'm down to maybe waking up once a night. So, but I do say every now and then, hey, I better try to strengthen that muscle a little bit to make sure that I'll go back to where I was.
Yeah.
I do often think about the Kegels, and I do try to do them, but now I know, so I need to do 6 and then do 6 fast ones.
Yeah. So you do 1 and you hold it for 6 seconds. So 6 and hold. No, do 1 and hold for 6 seconds. Do 6 sets of those, like you're exercising.
Okay.
6 seconds. Do 6, hold for 6 seconds, and then 6 really fast ones, 2 to 3 times a day.
Okay, so see, I definitely had failed on the 2 to 3 times. So
just do it when you're not doing anything else. When you're driving in the car, even if you did it twice a day, driving to work and home from work, you're done.
No, I like that. That's easy.
Yeah,
no, that's easy. That's easy. In the morning in the car on the way, that's easy to remember, and I can do it like you said, sitting in the car.
Yeah. And we have gotten so used to living with dysfunction in our lives, whether it's leaking, whether it's pain during intercourse, whether we see our relationships changing and not saying anything about it. And so one of the things that I want our listeners to kind of understand is like everything we go through, there's a little something that we can do about it. And then from the functional medicine side, I always got to get that little dib in there, is that like even Sonia, with your case, the fact that you did not sleep for years because you were going to the bathroom. Exactly. Sleep is a pillar of health. And that throws off the whole system. And then you start having other issues that weren't even related to, and it just goes on and on and on. And so the power of us talking helps us understand everything is kind of connected to, so the things that you do, Dr. Jean, are wonderful. But if we don't also address all of the aspects of our lives from the insides that are causing us to, and that's why I'm so excited, because as I tune my little ladies up, I'm saying, here you go as your graduation present to go get, the rest of your, and that's the thing, is a lot of, when I used to do vaginal reconstruction and vaginal surgeries and all, I would take care of their functional medicine issues first. And then I said, as your graduation present, we'll then now do the structural, because fixing that without fixing the inside on some patients is not going to get you anywhere.
Right.
So it takes a village.
It really does.
It does. And I always said, honestly, we and Dr. Jean talked earlier about, how you become ashamed. And, my biggest fear was, I was like, I don't have a partner, but I'm like, Lord, I can never have a partner, because they're going to be looking at me like, what is wrong with you? Why are you waking up and getting out of the bed every hour to go to the bathroom? They're going to be like, what is wrong with this woman? So now, I've got that part fixed. So now I'm like moving on. And, part of the whole self-esteem thing again is, as you get older, when, coming out of divorce and when I was married, you get comfortable with your body and you don't really start to pay as much attention. So now I'm like, okay, as I prepare to move on to the next chapter, and you guys are telling me there's still hope, that
Yeah.
as I start to pay attention to my body, I'm like, I don't like the way it looks like the, so that's when I started to say, well, maybe I need to do a little work down there. So I'm just happy to know that. And for our listeners, I want them to know also that there is still so much that we can do. And yeah, the self-esteem, and it starts to work on your psyche. You get in your head about these things. So it's hard, but there is hope, and there is ways that we can, there are solutions, I'll say. There are plenty of solutions for
Plenty
us.
of solutions.
And that's power for a perimenopause or a menopausal woman who otherwise, and that's, again, I say the same old things every time because they're so true. That's why our grandmothers gave up and our mothers gave up. They had no options.
That's
So when
right.
she was leaking, she just kept the house coat on, let him do what he's going to do and move on, because and taking care of the kids, because who's going to help with that?
Yeah.
And certainly if they had breast cancer or something like that 30 and 40 years ago, that was, you're done. I mean, you're going to live, but as far as your femininity and all of the things that make us feel our best were neglected. So
Yes, yes, yes. And then it's interesting that you say that, because when I was going through that initial change, and I asked some of my older, relatives, like, well, what did you all do? Like, did you have pain when you start going through menopause, when you had intercourse? And they said, yeah, yeah. So what did you do? I just did what I had to do. I said, okay, this is 21st century, so that's not going to happen here. So, that's basically what they say. I just did what I had to do. If I had the pain, I just had pain.
yeah,
There was nothing to do.
And how many of them gave up on having sexual activity,
Probably lots of them.
Yeah.
Yeah, yeah.
Yeah,
Yeah,
I have a question for you, and it's a little bit maybe outside of this, but for some, you talk about using the laser for to help with incontinence. For someone who is like wheelchair bound, does that how would the laser work for someone like that?
So someone like that, I would do the M-Cella.
Okay.
All they have to do is sit there, and it would help them. As long, like, there's some certain contraindications. Like if they have a pacemaker or anything like that, you can't do the Incella, because it's energy. So you can't, like, affect the pacemaker with that. You can't have like a hip replacement and do it. You could have maybe metal in your ankle and still do it, but any kind of metal in the body, then you can't do it. But someone like that, I would recommend for urinary incontinence, if they're in a wheelchair, is we do the Incella. Unless, I mean, if they're sexually active, we may be able to do the laser. However, it may take, I don't know, it just depends on how active. If they're still sexually active, yeah, if they would rather have a laser, we could do the laser. But it really all depends. And then what they're in the wheelchair for.
Yeah, yeah.
You know what I mean? So, but I think somebody like that, I would recommend M-Cella instead of the vaginal laser. But the vaginal laser, I mean, if you come for one thing, it's going to help everything else, because it actually rejuvenates the vaginal tissue. It takes you back. Like, I would say it took me back like 20 years, because, there were certain things you thought you couldn't do again. And then after that laser, and it gets like better throughout the year, the first 3 months, you see definitely improvement, but you continue to form collagen and elastin as the year goes. It just gets better and better. And then the more active you are, it just gets better and better.
Did you ever consider any like PRP treatments? Is that
So I
because
do.
we did that a lot overseas, and when I came here, they don't do it at all, and they work wonderfully.
I do the PRP treatment. So here
good.
I do. I introduce both to patients. Now the PRP, if you're just having issues with vaginal dryness, the PRP is ideal. It will also tighten the vagina and also add some collagen. Depends on your age group. Because, say, my PRP at 60 is different from a 30-year-old PRP.
Mm-hmm.
You follow me? Because PRP is just your blood spun down, and then the serum from your blood. So that serum has certain like immune products and all of these restorative products. But mine in my 60s is going to be different from someone's in their 30s. So I get people in their 40s and say, you know what, I just want, give me a PRP and then I'll come and do the laser. And they were using lubricants. And they went from using lubricants to using no lubricant at all.
So
42, my 40s.
can you say what PRP is for those of us who don't know?
So PRP is plasma. So plasma protein.
Yeah.
So what you come into the office, I draw your blood, I spin it down, and I take the serum from your and it's what we call off label. They found that it helps, but it's not like anything that they've done research, but they found that it helps out a lot. And
yeah, we did it a lot. See, we did it a lot over in the UK. And when I came back, well, in the Middle East, but when I came back, again, it was still foreign.
Yeah.
They just this I mean, it works.
It works.
We would call it
What
liquid
age
gold.
group did you what age group were
My
you
own
doing it for?
PRP. Listen, all of the stuff that I do in my office I've had before because I wanted to make sure that it worked. I do my own PRP. I do my own
Come
laser.
do your PRP for you.
Oh, go ahead.
Come do it for you.
PRP. Oh, and basically, what you take that that serum and you introduce it into the anterior vaginal wall, and I also put it in the clitoris. So 1 cc in the clitoris, and then 3 to 4 cc's in the anterior vaginal wall, and basically, it restores also. So it gives you a lot of.
You guys just threw a whole nother monkey wrench.
So that would be the O shot and the G shot. Yeah.
So wait. So what is that? Say that again, Kathy. That's
so the O shot and the G shot. So you would just basically take the PRP and inject it around the clitoris to rejuvenate the clitoris. Remember how we always talk about putting the hormone, the estradiol around the clitoris?
What I do.
Bring the blood
I do that. I just did it last night. Okay.
Yes, so you could have a PRP injection into the edge of the clitoris to cause rejuvenation, so that when you're held, you feel held. I mean, you feel the blood supply.
Yeah.
And you can do it inside under the G spot. There's a spot in the anterior vagina that you can inject the PRP. And we would use filler too. So we'd put PRP to rejuvenate, but also a little filler to create some weight to pull it down, so that it would be like something to stimulate for orgasm.
Mm-hmm. So a lot of the plastics do use filler. I don't use filler. I just use PRP because fillers kind of are.
Well, we wouldn't use them around the clitoris, but we would use it at that G spot.
At the G spot, yeah.
At the G spot, yeah. And I do urogyne surgeries too, so I kind of felt comfortable with that. With that area, putting them in. People who don't do it a lot, I probably, that would scare probably a lot of people, but they work. Yeah. And these are things and I'm so glad you're doing this, because a lot of gynies, because it was no, and it's just like as though we're not deserving. Yeah. We're not deserving to feed, you're pumping them up with Viagra and we have nowhere to go.
Exactly. So, and I also take some of the PRP, inject it into like the vaginal wall and just all over, and it does rejuvenate and it helps. The only thing is that one you have to do like every 3 months, whereas the laser, you don't have to do it for a year and a half.
So wait, does that PRP, so is that like a fine needle, or what is that painful, or you have to numb that area?
Well, the clip, I mean, I use a 30 gauge needle, which is tiny.
Because I'm scared of needles, so I'm asking.
I put local there.
Okay.
I'm the area.
Sure.
Most people don't feel it. I mean, it's like nothing.
And the recovery time after that is what?
Now, see, that one, for those people who say, well, I can't do 7 days down, because that will rejuvenate the area too, not to the extent of the laser. But they'll say, oh, no, I can't do 7 days. That one in 2 days, you can have sex. I mean, I tell people 2 days. You really can have sex the next day. But what I found that most people who have sex the next day says, oh, it's still a little sensitive down there. It's like, well, give it some time. Just give it one more day if you can hold out. So I say 2 to 3 days, but you can really have intercourse the next day if you wanted to with the PRP. So that's how. So I give them the option if they don't want to do the laser, like, oh, I don't think I can wait that long.
And they really, if you do them together, work wonderfully too. Like do the laser first and then just take the tube of the PRP and just squirt it in there and let it, or put it on a tampon, let it stand, they take it out. And I would do that a lot on patients who couldn't do any of the hormone, or we did just a little so we could get the thing in, the probe in. Then we come off of the hormone and then we just squirt the PRP in after the treatment.
Yes.
Mind blown, huh, ladies? You
That's
see,
right.
I was gonna say,
you see,
boy,
you
our
have a
listeners
jewel
today,
here who can.
we're giving some good
That's right.
today,
We're always
boy,
talking
like all
about
these secrets.
healing us on the inside, and now to be able to add the gift below the belt.
Exactly.
That's right.
The gift that keeps on giving.
Absolutely. We don't have to age. We'll be
That's right, we
100 saying, "Excuse me."
That's right. That's right.
It's funny because I'm here and I'm taking notes. I'm like, okay, this can work, because inevitably someone's going to ask me and I want to make sure I can answer the question.
Yeah.
And I do want to make the point, though, because I've done it all, is that all of these things honestly work better. And I hate to say this, it's not, and this is just really for our better good as women, is when we address our internal health and we make sure that, all of because aesthetic treatments may not take care of all of your anxiety and your insecurities. A lot of that, Dr. Jean, can come from the imbalance in the microbiome. You know what I mean? And on how we manufacture and metabolize our serotonin and dopamine. So I always just kind of encourage that we look at ourselves totally so that we can get the benefit. And, any patient that you come in and you've done, those patients, you've done everything you could possibly do and she's still not happy. Yes. There may be something on the inside not balanced, and you just give me just send her on over and we'll get her. Because honestly, we just deserve to have everything that's available for us to not have to really be on any medications. For our brain health, our vaginal health, our skin health, our hair health, all of that. And so I am just so excited about the total package and to have someone who can really help us with that intimate area.
Yes.
Because that's underserved and overlooked.
No, it is. And I don't know, plenty of, most GYN offices do not carry the laser because the laser is very expensive. But when it's done so much for you, it's not even like you don't even think twice about it. When I told them, listen, this laser worked for me. If you will train me, I will buy this laser. And they did, but I felt like it was worth it. Yeah. But because it's so expensive and it takes getting patients to order to do it, it's kind of hard. Now the bioidentical is an easy sell because it's less expensive. So they are really pushing the bioidentical, which I think some patients do need it. The bioidentical hormone replacement, they're really pushing that a lot because it's really, it's more cost effective. But for me, I just, the laser worked for me, and that was my route because of the breast cancer. I didn't want to introduce a lot of different hormones and things in my body if I didn't have to.
But I think I know that when I worked in corporate medicine and, we had a 20-minute visit, we get 10 minutes with the patient. So there's not a lot of times to educate. And I think if we start helping, patients understand the value of what you do, the value to them, and then we look at them holistically on, you're going to also not only have your sexual health back, but you're going to feel better, look better, and have all of your longevity markers in check so that something doesn't creep up. They don't give us time to educate about that in conventional, especially corporate medicine, and they're the ones who've taken over. So I think the more that we have podcasts, the more that, we get you on here again and we just keep talking about it and helping women understand it is a value. And when we look at all the other things that we spend our money on that are going to kill us, to restore yourself and be healthy is just, I think that's all we have to do is really just continue to just educate the value of what we all, want to see is just good health and longevity.
Yes.
Wow. This has been great. I'm telling you. I mean, I may have to sign up to come see you there, Dr. Jean.
Come on. that way I can actually show you. Maybe, the laser and what it looks like. For all that it helps with, I always call it, I say, this is my baby for all it helps with. It's not a big machine or anything. It's just a little machine. It's such a small procedure that creates such a great result.
And how long does it take each session?
So each session, your first session a little longer because I start with the local anesthesia and I like for it to be working. So I leave it on for a while. It takes about 20, 30 minutes. After that, the actual session doing it doesn't take only about 20 minutes for internal and external. It's a quick procedure. Now, the second time you come in, usually what I do is send you home with the local anesthesia after I showed you how to place it. I just like the first time to make sure that, you don't have any reaction or anything. You put it on yourself, you come in and we take, you have the local on and then we go from there. Sometimes I add a little more. So the session is shorter. You're done in an hour. We just,
Okay.
I take my time, no rushing. We talk about it. We make sure, that you're good with what to expect. And like an hour, really the procedure itself is 45 minutes. Maybe you could spend in my office 45 minutes for everything.
Okay.
Well, I just want to say to any of our listeners, if they're questioning, does it work? It works. And most patients will, after the three treatments, most patients will come in for their follow-up first visit in a month and say, I don't really feel anything, but we noticed something. The second visit, they'll come in saying, I'm kind of feeling something.
Yeah.
And then the third visit, we're both feeling something.
Yeah.
And happy and smiling and content.
Yes.
Over in the Middle East, in Dubai, the value was because it didn't matter. They put the money down, they did. And so I was able to see a large number of patients who did it. It works. It works.
I promise.
And so, if you can figure out a way, I mean, if that is your issue, if intimate, because things do change at menopause. And we talked about before the elasticity changes after having babies and undetected problems there. Then when we get to perimenopause and all of that goes, you either give up or you invest in yourself that you want to continue intimacy. And, there are women, I have women in their 80s.
Yes.
Who let's just say they're on hormone replacement. The vagina looks 25 on the inside. If you add a laser treatment to that, I always tease with them. Don't let me find you on OnlyFans. And so really, and sometimes we just need somebody to who we trust to tell us the truth. And I'm telling you the truth about that these treatments work. They may have a little price tag on them, but they're very worth it when you look at your intimacy, your relationship, your marriage, and I agree with her, this is not for him.
Yes.
This is for you, because a lot of us have forgotten what it feels like to feel penetration.
Yeah.
And so then when you're ready to pull the remote control in the middle of it because you forgot you were having sex, it's because you're not feeling anything, and you can feel that again. And for years, again, because I feel like I'm the oldest one here, doctors had told patients, I don't see anything wrong. This is all normal after having a baby. What are you talking about? And so patients in their minds may have brought it up a time or two. Nobody validated it. If you feel like you have a problem, please see her, especially if you're here in Florida, because it will make a world of difference in your life.
Yes.
I'm signed up.
Right, girl.
I'm going to go see her.
Oh,
So
can we
we'll
come on that? Can we come on that day? Can we come on that day and do a little? We'll just be outside the room, but we can do a little chat and
that'd be great for sure.
And let people see how well you did.
I guess you don't have to be from Florida. I have people come from all over Colorado.
Wonderful.
From the islands. We make it work. They come.
That's right.
Well, I'm going to sign up and we can do a follow-up after, and we can talk about how it felt.
First month, second.
Yeah.
Now we've got to work on getting you the somebody
person?
to our tester.
Exactly, right. I forgot about that. I do need somebody to prove. Yeah, I got to work on that piece. Yeah.
Well, what was that movie? Build it and they will come.
Remember, I got to gain my self-esteem and get mentally ready.
And we're getting there because, baby, you're a whole lot different than a few months ago. So,
I know, right?
Yes, right. Yes, right. So let's just keep making steps forward, because again, the inner you and the outer you together, that's a
Both together.
powerful woman.
Yeah.
And you can't really, in my opinion, have one without the other. And so that's why, Dr. Jean, I encourage you, if you have somebody who basically, I love those patients who the doctors say, tell me they can't do anything. I'm aching. I have thyroid antibodies. I can't lose the weight. All of those kind of things. If things aren't working, there's something internal, microbiome, the hormonal axis, the metabolism, all of that we fix. And so I would just encourage that anybody who's not feeling well, one way or the other, stop by me or stop by her, and we'll make sure you get the whole thing taken care of.
Absolutely. Absolutely.
Dr. Jean, I have been laughing and enjoying myself this entire time because this has just been so good to hear everything that you have had to say. And I think about, Sonia and I will be newlyweds, as older newlyweds.
Yeah.
At some point in time.
Be in there one day too.
Right.
I want to be in there one day too, but just not right now. Right there.
Look, Denise and I are just more vocal about it. We
I'll take the fathers of whoever, whoever you guys may find. If he's got a father still alive, I'll take him.
So
Not that old. I'm probably she's the oldest one. I think I'm the oldest one on this call.
No, I think I am. But this is what functional medicine does for you. It's all supplements and lifestyle. So.
But I know. So, I think this has been so awesome to know that, we have options, we've got solutions, we've got people like Dr. Jean and Dr. Kathy who will to take care of the inside and the outside. And, as we age and we deal with the anxieties and the insecurities of aging, to know that this portion of our life, our sexual life, does not have to end. And that is so important. And that we have the option of making it better for us than, let's say, our parents or grandmothers did. So, Dr. Jean, I've learned a lot from you, and I'm so glad that you have come on our show. But before we sign off, I would like for you to give us your contact information. Tell us about how the people to reach you and so that they can call you themselves.
Okay, they can reach me by phone at 954-445-6077. That's the office number. And I am on Instagram under Rejuvenation for Her. And it's a hummingbird with a circle, purple. That's my soft color is purple. And there you can contact me through there. You can also visit rejuvenationforher.com. That's the website, and it has all of the devices and everything I have in the office, because I also do different, other than the vaginal rejuvenation. That vaginal rejuvenation happens to be my niche, but I have other things in the office like hair laser removal, body treatments, all non-invasive, nothing over.
Second episode.
Yes. Exactly.
Second episode, ma'am.
Oh, it's all there. So
you'll be back. We'll have you back.
We're having you back.
rejuvenationforher.com, and you can find me there and make an appointment there also.
So Rejuvenation for Her, love the name, .com. Dr. Jean, thank you so much. Unfortunately, we've got to sign off, but I can hear my partners in the background saying, second episode. Okay. So it sounds like we're going to have to bring you back. Thank you so much for being here.
Thank you so much for the invitation.
Thank you, Dr. Jean. Thank you so much.
Thank you.
All right,
bye-bye.
This is
Menopause Diaries, real talk, real stories.
Thanks for listening. Let's thrive together through every
Hot flash,
mood swing and sleepless night. Don't forget to like, share, and subscribe to Menopause Diaries, Real Talk, Real Stories. If you have questions or want to share your story or would like to be a guest, visit us on Instagram at Menopause Diaries Podcast. Let us start a conversation and navigate this journey together.